We'll get started. And we're going to start with introductions. So, Lily, why don't you kick us off?
Okay, can everybody hear me? Perfect.
Yes.
So my name is Lily Hotarula, and I am a K-5 computer science teacher for the New York City Department of Education.
Hi, I'm Cindy.
Cindy, there we go.
Okay,
Yep.
Awesome. I am also a K-5 NYC DOE teacher.
And what do you teach and where do you teach?
Technology. So CS, digital literacy, and digital citizenship.
Oh, oops. So I just teach basically computer science in a project-based classroom, and I teach at PS 133.
And I'm Diane Levitt, and I'm the Senior Director of K-12 Education at Cornell Tech, which is a new graduate campus of Cornell University on Roosevelt Island. I lead a team of folks who are all working to make computer science teachable in New York City public schools. Natasha.
Hi, I'm Natasha Singer. I am a technology reporter at the New York Times. And it means that basically I spend my days asking questions of Google and Facebook and big startups like Airbnb and small startups that haven't launched their innovative health products yet. And my job is to kind of ask them about the downstream privacy, security, ethics, societal bias consequences. And so often the answers I get are, we don't understand this question. Nobody's ever asked us this question. And my personal favorite from tech companies is, we don't think this is a valid question. And so the reason that I'm here with you today is because I got frustrated in my day job being a technology reporter. I developed a course for high school students about how to think about these questions and how to become like what I think of as kind of moral debuggers, right? They become detectives and they learn how to ask these questions and they learn how to think about what are the potential societal consequences of this thing I am making or this popular technology that exists. And the idea is to learn how to kind of anticipate and mitigate the harmful consequences of innovative tools. And so we're going to go through some of that today. And I'm just going to show you, like, as a journalist, how I act like a detective, but it's also how I teach students to kind of think critically about these tools.
So today what we're going to do is we're going to take a tiny piece of a workshop that we lead at Cornell Tech called Creepy or Convenient. We're just going to take 1 or 2 slides from that workshop and kind of peel back the layers of what we try to talk to students about and what's really going on in the background in our goal to sort of build students' agency and interrogation skills with technology for whatever purpose they're going to do with them. So I'm going to go ahead and hit the deck. There we go. And at the end of the, and can everyone see my deck in presentation mode now?
Yeah.
Okay, great. First, I'm going to remind you that if you double click on the deck, it will be much bigger on the screen. We've also put a link to the deck in the notes if you want to use that. And I know BT put this in the chat, but I'm going to just remind everybody that if you're the data and privacy reporter for the New York Times, you don't want your picture on the internet. So we ask whenever Natasha and I speak together, I remind people not to take her picture. You're welcome to screenshot the slides. I don't have the same sensitivity, although I don't need to see my picture online. But we don't, just don't screenshot Natasha.
Thank you.
No worries. So, so we'll kick it off. What we're going to do today is that I'm going to present, this is actually a slide from Creepy or Convenient. And the way that we do this with students is that I describe a use of data online, and then we ask students to discuss it. And in their discussions, we use that as an opportunity to talk about ethical decision-making in technology development and in technology use. So today, Lily and Cindy are going to be our sort of students and teachers, and they're going to they're going to be the discussants. So it's a little bit of an experiment. We're pretty excited. So this is a slide I present about a company called Kinsa. This is a thermometer. Some of you might own it. And it's used, the magic of it is that it takes your temperature, but then it loads your fever into your personal data file in the cloud. So it's very convenient for people who are, for instance, trying to get pregnant and tracking their temperature to predict ovulation. It's, if you're got to have a child who's running a fever and you're trying to track it to share that information with your pediatrician, it's very convenient. You don't have to like write it down on a Post-it note that you lose, speaking personally. So all of that is really useful. However, one of the things we learned about Kinsa is that in addition to tracking the data for you, they are tracking the data for some of their third-party partners, including Clorox. So when Kinsa identifies a hotspot, a fever hotspot in a building or in a neighborhood, they'll share the contact information with Clorox, who will then send a coupon for Clorox wipes. Because if you've got fever in your house, you're probably worrying about germs. So I'll just say to our teachers, what do you think? Creepy or convenient?
Well, actually, I'll play
Creepy.
Okay. So Cindy, why don't you kick us off? Why is it convenient?
Well, am I putting on the high school student hat, or can I talk?
Why don't you go with who you are?
Okay, so I would say I have two children, so it's convenient for me if I need to track my kids' fever, and then also thinking about if I need to send them to school or not. It's a convenient way for me to keep track. And then I'm very forgetful because there's so many things I could look back. Oh, the last time he had a fever, when I talked to the pediatrician, like you mentioned, he was sick 2 months ago, and then maybe I could connect that to, oh, right, every time he gets sick, we're at a bouncy house, so that can help.
Remember bouncy houses? Okay. Lily, why is it creepy?
I find it creepy because actually something similar happened to me the other day. I was buying baby wipes for my nephew. I myself don't have children. And then this week ShopRite decided to give me the CVS lineup of coupons. That was all baby themed, but obviously that's not the products that I'm going to be buying. So it feels like a little bit like they're funneling me into a certain consumer track.
And I will say there's a whole page in Creepy and Convenient just on loyalty programs. But you're 100% right that they think they've tagged you as a person who buys baby things for a reason. Natasha, is this creepy or convenient?
And I'm a person who bought products for elderly relatives, and so I started getting ads for Ensure. So Lily, I completely understand because I didn't need elder vitamins either. Right? So part of it is it creepy because they've made a mistake? Or is it creepy, because my colleague Charles Guggenheim wrote a piece about how Target knew somebody was pregnant before she told her family, right? So it can be creepy when it's accurate, and it can be creepy when it's inaccurate. The trouble is it's both, right? You do want a digital thermometer. You do want the information to be kept somewhere so that if your child has fever patterns, maybe you can take it to the doctor. The question is simply, if I am paying for this thermometer, why do you also get my data? I guess I think about it as a journalist. Apple and, well, not Apple, but Google and Facebook and others have established this idea that we're trading our data for free services, right? And I think that's complicated, and we could talk about that another day, about whether that's an okay trade. But if we're going to accept that this is the trade, then why do I have to pay for a thermometer and you get my data? I just feel like you're taking too much, people. Anyway.
Let's take it back and let's talk about privacy. I saw a couple of people in the chat ask about whether there's an opt-out here. So we thought we would share the some of the privacy permissions that are here for Kinsa, and have have Natasha sort of make some of this more clear to us. So as privacy statements go, how is this one, Natasha? Uh-oh, I can't hear anybody. Natasha, can we hear you?
Okay.
Oh, there you are.
Okay. So first of all, every company tells you that protecting privacy is important, right? If they don't tell you that, like, I don't know what it means, but basically it's like saying the sky is blue, like we care about this. Then like whether they do or they don't depends often on you reading this 10,000 word long thing and trying to figure out what they're doing with your data. And they believe, right, that fully anonymized illness data should be used to benefit society, and that personally identifiable data should not be shared. But the trouble is, how do we know what is de-identified and what is aggregated and what is anonymized and what is identifiable? Because if they just take off your name, but they leave your, zip +4, and you get an ID number that they can track over time, it's not anonymous, right? It's pseudonymized, so they can still track you over time. I think that's worth thinking about. Like, I believe that Kinza's trying to be clearer here, but it's still, the issue is, how would a normal person figure this out? Like, how is a normal person going to devote an hour or half an hour to reading a privacy policy for a thermometer they bought for their kid who's sick? Like, who has time for that? So I think that it raises all sorts of interesting questions, and because of this, I do an exercise with 9th through 12th graders about reading privacy policies. And I'm interested to know from the folks in the audience, have you ever taught your students, have you ever asked them to read a privacy policy? Because I would be interested to see what happens. What's happened with me is that I divide the students into groups because these policies are so long and in legalistic language. So I get like 4 kids per policy. And what we've done in my class is that we have chosen apps that kids actually use in their class. So it's completely personal to them. It's not some random cooking app their grandma uses. So we've looked at Remind, we've looked at Google Classroom, and what I find is, and because they're so long, each kid gets like 4 pages of the privacy policy to read. And they're all like, oh, this is so long, this is so boring, Ms. Singer, do we really have to read this, right? And then like 3 minutes later, you hear these, oh my God, right, is this legal? They can do this with my data? I have one student who was in a group of athletes, right? And so they wanted to read the privacy policy of the coach required them to use for their team, right? And the software tracked their stats, their weight, their blood pressure, their games. It had the away game schedule for their parents. It also had video of their performance. And what they discovered, because you could hear them like yelling across the room, was that the company who was providing the software to the school had the right to use their videos and had the right to their data. And they had no idea where their data was going. And this was also health data, right? How fast can you run? What's your BP? Did you miss any games because you were injured? And some of these kids are trying to get scholarships to colleges. And do they want this information that they didn't know was being collected by a company to be shared? And so it could have real consequences. And so I found just by asking students to read the privacy policies, they are finding things themselves and they are asking themselves these questions, and it pertains to them. And so you don't have to explain why it matters. They immediately get that this is their data. And we went even further with a couple of students whose parents gave us permission, because the students wanted to ask the companies, what are you doing with my data? And so we had one student, well, we had lots of students who wrote to different companies, and one company wrote back and they said, like, I am in a class, with Miss Singer at the School of the New York Times, and this is my summer assignment and whatever. We were completely transparent, right? Because journalists are transparent. And one really big company, who many of you may use their app in your class, wrote back and said, why do you want this information? And also, we're really busy and we're not going to be able to get it to you until October anyway, but we'd like to know why. And we contacted a privacy expert, Bill Fitzgerald, right? And Bill said, why does that make a difference? Either you have a policy, students can see their data, students can know what you do with their data, or your policy is, we're not going to show students the data. It shouldn't depend on what the student wants to do with the data, right? And so that was also really eye-opening for students. And in another case, the student used in their class a kind of student information system with their school. And, he did research, and this was like a 10th grader, right? This system was owned by another company, that was owned by another company, that was owned by another company, and kept writing, and nobody wrote back. And finally, we figured out which company owned the whole mess. And we figured out who was like the vice president in charge of privacy. And that guy didn't respond. And I'm like, let's just call and see what happens, right? And so I was in the room, we put the phone on speakerphone, we called this vice president, and he was outraged, right? And the student said, hi, I'm John, I'm a 10th grader, I'm working on this project, and you own my student information system, I'd like to, and the guy hung up on him, right? Which was also an education for a 10th grader, that it's really hard to get your data. And often I find if 8th graders or 9th graders write to people actually do respond because they do want to help students. But this was the first time where even a 10th grader got hung up on. And so this is just a big lesson all by itself. You don't have to do anything fancy. And the kids are the detectives, and they were uncovering these things for themselves. And then it dawns on some kids that wow, this is true for every single app I use. Every single app I use in school, or my parents' smart TV, for Snap or whatever you have on my phone, Insta, TikTok, right? So but I did ask, and I didn't really see any answers. I'm sorry, because I was talking. Have people tried this privacy policy thing with their classes? Lily, have you?
I haven't done privacy, but we've talked about what it means to be farmed for your data just by using browsers. So I brought up this idea of, not the idea, but the actuality, the Tor projects. With my older students in 4th and 5th grade after we discussed AI and machine learning. And they said, well, why would this project exist? And that they were very stymied by the idea that something like this even existed. Why not just use Google? And for them, it's like, Xerox. It's a copy machine, but it does everything, right? Like Google is now the layman's term for just doing a search. But when we dug a little deeper into it, they did not realize how much tracking Google actually does within their one search. And then I said, this is why we do that, why people are trying to go into the Tor project and using that as a dedicated browser, because you're not being farmed for your data. And then their question was, well, Ms. T, what are they using our data for? And how come they're using it for free? And they felt very exploited. As much as a 9-10-year-old can be feel exploited, they did. And I said, well, you're kind of using Google for free. So now anything for free, there's a give back. But they weren't aware. So once they were aware, they felt so I can't even tell you the responses. They're like, do our mom and dads know about this? The first thing that they said, I was like, I don't know if your mom and dads know about the Tor project and how much data is collected on all of you guys. But then they went home and they started having these discussions, which brought more of a critical awareness within the community, because most of my children are children of immigrants. So this was very interesting.
One of the things we say to children is, if the product is free, then you are the product.
I want to piggyback on what Lily said. I teach students about their search history and how you can track what is saved and where they've gone. And so that surprised them, because they're like, oh, if I just close the browser, if I just look in incognito mode, then no one knows what I'm looking at. And I'm like, yeah, I can actually reopen your browser and show you where all that data is. So that's really important for kids to understand that everything gets tracked. All your data gets tracked. Every time you download a third-party app, it's like, do you give permission for them to read everything in your drive, everything that you have? And so bringing those attention and raising those awareness is really important, especially for young digital users. And that's why it makes digital citizenship lessons so critical. And I know someone in the chat brought up Common Sense. That's such a great resource to use to spread digital citizenship everywhere, because everyone needs it, even adults, because because someone said, a parent came to me and said, wow, a child has access to 9 billion people right in their pocket. And that's so true. How are we going to teach these children how to navigate this world?
And I see Wendy in the audience has a couple of questions. One is about, with COVID-19, we have to give away all our data, and in some countries you have to check in every location. So do people really care about privacy right now? And the second question is like, show me the harm, not just hypothetical harms that could happen. So Wendy, we're going to get to that. We're about to hit the COVID stuff. And also, basically, we've been talking a little bit about corporate surveillance, but we also are going to talk about what happens when governments are using corporate tools to surveil people.
So we have actually in the deck, the next slide is also on privacy, but I'm on the privacy policy, but we'll just move on, except for you should know that they reserve the right to use your information for research purposes. And should they reorganize, merge, your data belongs to someone you never gave permission. So, Kinsa in the time of COVID.
Right, so Diana's just talked about the Kinsa thermometer and how it can sell your data to Clorox to show you ads. But now, this is the same Kinsa thermometer, and the idea is that it could be used to track the spread of the virus. And so this is an article about how great that is, that it can do all this kind of predictive analytics, and it can sort of see abnormal patterns of fevers. And wouldn't that be great? Because maybe we could predict COVID outbreaks ahead of time. And on the next slide, we sort of think about what the implications of this are. And so it's like, we do want public health officials to be able to use new sets of data to help identify outbreaks. But on the other hand, like, what are the trade-offs of, again, you have bought this thing, your data is going somewhere. It's said to be anonymized, but even if we look at it at the aggregate level, and certain pockets, certain neighborhoods now have high fevers, and maybe that's a COVID hotbed. One of the things we're seeing is there's a disparate impact with COVID. We're seeing much higher incidence of COVID in lower income neighborhoods and Black neighborhoods, partly because they're essential workers who have to go to work. And so what happens when companies say, I don't necessarily want to open in this neighborhood where there's all this COVID, right? Like, some of this we want, and some of the consequences could be detrimental to a subset of people. And like, how do we think about that? And Lily and Cindy, I'm going to come back to you, but like, Diane, let's go on to the next couple, and so we'll ask a bigger question.
Great.
So we've looked at now, your personal thermometer is going to Clorox, and now the thermometers are being used maybe to track COVID outbreaks, and now we get your employer now wants to take your temperature. So that could be the school wants to take the temperature of teachers and students every morning when they come in, or it could be Subway, or a factory, or a warehouse that wants to take your temperature. And so now we've gone from you as an individual chose to take your temperature and the data is going somewhere, to your boss or your school wants to take your temperature and you don't have a choice, right? In order for you to go to work, you have to have your temperature shaken. And so before we go on to the next part, I'm interested in, Cindy, maybe what do you think about this and how would you talk about that with students? All right, repeat.
I think it's creepy because I see the good intentions to make sure we were fever free when we're at work, but can that be done personally at home before they go to school? And so it becomes a personal data where they keep to themselves, and you shouldn't go to work if you have a fever at home. And given what we know about COVID, it's a lot of times it's the asymptomatic people that are spreading it. I would take a step back and not. I think this is too creepy to have in businesses. And also, like, what are our employers going to do with the data that's being saved on these apps? Are they going to be selling it? Are they going to use it against us? Insurance companies are buying the data. Are they going to increase our premiums or discriminate against people who might have higher risk disease? and not hire them in the future. So we don't. Those are questions, more questions.
I think those are really important questions. You know, what is the employer going to do with the data? And is this appropriate? And some people are not going to have fevers. So like, is this going to give people a false sense of security? But can we go on to the next slide? There was a professor at NYU, Dr. Ann Washington, and she wrote an essay about this on Points, which is the Data and Society website. And it was called Pandemic Privacy in the Workplace. And first of all, you know, we're getting to the point where some stores, some restaurants are going to require temperature taking by consumers, shoppers, as well as employees. And so one of the questions becomes, like, who's going to know, right? Not just what's the employer going to do with the employees' data, but what's going to happen to the students' data? What's going to happen to the consumers' data? And should you know, right? And it's a reasonable question. We're in a new world, and there are new questions. And maybe you don't want to go to Starbucks if your barista has COVID, or maybe your barista shouldn't be there if they have COVID. Can we go on to the next slide? Because the big question she's asking is, given that essential workers are the ones who are having these tests the most, right? Because people who work for big tech companies, if they don't want to have their temperature taken at work, or they don't want to fill out the daily questionnaire about their health symptoms, might simply say, you know, Twitter said you never have to come back to work, right? And Apple and Google and Facebook have said you don't have to come back till at least 2021. So is there a disparate impact of this kind of surveillance because it's essential workers who have to have their temperature taken?
Including teachers.
Yes.
I just want to comment because Michelle's put a question in the deck that I think is worth surfacing as we walk through this. She wants to know what the goal of talking about these privacy lessons and others with students are besides awareness. And I just want to point out, Michelle, that our students will leave us and go into positions all over the workforce, right? They will be teachers. Some of them will be software developers. Some of them will be product managers. Some of them will be policymakers or funders or work in large corporations. We want all of them to understand all of the ethical implications of the tools that get built so that they can build them better, they can interrogate them better, and they can use them more thoughtfully and consciously. So that's the reason why we think this lesson is important. I just want to put that out there.
And I also think when we say ethics, we really mean, you know, the downstream consequences, right? It's not ethics, this is ethically okay. It's if we learn to understand what the consequences of something is as we're building it, or, you know, we're seeing local city councils around the country ban facial recognition, right? While we're building it, we could mitigate the harms. Or if we're the local city council and we understand how these things work, we might be able to intervene and write better policies. So it's really about having a say in the technology that you use and making sure that it benefits society and doesn't put more risk than it does benefit. And so I feel like every student can go through this and think about affect me, but how does it affect my family? How does it affect my neighborhood? And if I'm going to be the founder of a startup, or if I'm going to get hired by a big tech company, or if I'm going to be the advisor to some senator or local city council person, it's really useful to think through all this stuff because your constituents are going to have things to say about it. You know, but one of the other reasons to think about this is we're going to talk about in the next slide. And also it goes back to what Wendy asked. When we think about these temperature scanners, unfortunately, they're notoriously inaccurate, right? So we're asking, well, so when you ask, what's the harm? Well, the harm is the way that these temperature scanners work if they're infrared is they're scanning your skin temperature, right? It's not like a thermometer you stick in the mouth that's taking your internal body temperature. And so that means that if you just run in from the cold, or if you've just been running and you're sweaty, or if you're stressed out, or if you're ovulating, or if you're in menopause, or who knows what else, right? Your temperature may be slightly different when you stand in front of this infrared camera. And also if you're not positioned in the right direction, or if you're wearing glasses, or if you're wearing a hat or anything else, the temperature could be wrong, right? And so Wendy asked, what's the harm in that? Well, the harm in that is that employers, for example, and I would love to know about schools, are setting different standards for what happens if you have a high fever. So some temperature control are set at like 100.4. So if you're above 100.4, your employer is automatically going to send you home. Other companies are setting it at 99.9, right? And you're just automatically going to be sent home. And if you don't know this thing is inaccurate, you could be sent home, and your boss might say, you actually have to stay home for 2 weeks in self-quarantine because we're worried you might have COVID, right?
Hey, Natasha, would you share with people what this technology was created to do? Because people think it was designed to take our temperature, but
right.
You shared with me that that's not the case.
Right. All right. So this is also a case of all companies kind of wanting to help make the workplace safer, but also make a buck. And a lot of these infrared cameras were designed to detect humans in a space, right? Like, is there a temperature in the space, like, you know, in a secure biolab, you know, or in a part of the warehouse where people aren't supposed to be? It's basically a human detection body heat system. It was not designed to take people's temperature. And when COVID happened and employers and schools were thinking about how do we reopen, many of these companies rushed in and said, well, I have this fever screening tech, but it's not fever screening tech, it's human detection tech. And the Food and Drug Administration actually put out a white paper on this because they were worried. And the FDA said to employers and to companies that make these thermal cameras, listen, we're in an emergency and we understand you want to use these things at airports and malls and restaurants and workplaces and warehouses and factories, but use it just to get an initial temperature reading. And if somebody has a high temperature, you must have somebody on staff with a medical grade thermometer who can retake somebody's temperature with an accurate device. And the problem is many employers don't know this and they're sending people home. I interviewed General Motors, right, who of course have lots of medical people on staff and lawyers to read all this stuff, and they employ nurses. They have medical offices. So if you come into an auto plant that's a GM plant and you have your temperature screened and you test high, you know, somebody else is standing there with an actual thermometer to measure you. And then a decision might be made based on your actual temperature. And so there are actual financial consequences. And some people, if they're told, you know, take 2 weeks off, they may not have insurance, they may not have vacation, they may lose money, they may lose their job based on a device that actually wasn't intended to take your temperature. So Wendy, here's a direct consequence. It's not a hypothetical consequence.
I just want to ask Lily and Cindy, obviously in this time where our anxieties are higher and our needs to understand are higher, we're using a tool that may or may not be accurate. It's a gross detection system as opposed to a fine detection system. Is that creepy or convenient?
Yeah.
Okay, and I'm curious in the chat. And I'll say the other reason why we all need to know this and our students need to know this is that when our students go to work and they're sweaty because they ran or they were on the train, right? And they run a fever of 100 using a thermal scanner, they need, rather than to lose that day's pay when they get sent home, they need to be able to say, you know, I've learned about this technology and I'd like to take my temperature with a thermometer, please, because I know this is inaccurate. This is true digital agency for our students. Okay. Am I ready to change the slide?
Yeah, let's go on to the last point about this, and then I really want to talk to Lily and Cindy about like how do we teach some of these ideas, because what you're seeing is, as a journalist, I've been writing about this, right? And I just start with the idea that, wow, there are all these temperature scanners and everybody has to have their temperature scanned, and like, what does this mean? And like, then you get into, well, actually, you know, there are all these privacy issues because one company actually sent me their employees' temperatures. They just wanted to show me what it looked like, right? Which is not okay, and I deleted it. But they didn't see that the people's temperatures were kind of a private piece of health information. Okay, so here's the next one, you know, and Lily already mentioned this, which is many people who either are infected with the coronavirus but haven't really developed it yet, or have the coronavirus and are contagious, do not actually have fevers. They may have other symptoms, headache, stomach ache, loss of smell. They may have no symptoms. And perhaps 40% of people infected with a virus or more do not have a temperature. So now you have a temperature device that may be highly inaccurate, but also even if it's accurate, it's going to miss a lot of people. And so, it's interesting to discuss with students, what are the implications of this? And like, is this better than nothing, right? Like, that's what employers say to me when I interview them. They say, look, we know this isn't perfect. We have all these other things. We have social distancing measures. You can see my employees wearing a mask. We have these signs on the floor where we have to stand 6 feet apart. This is just an added tool, right? So I'm really interested in how you would think about this and what kind of questions you might ask students to help them think through the layers of some of this.
And I'm actually going to interrupt. I'm sorry. I think we have 5 minutes left, and I want to get to the 5 questions. So do you mind if I advance the slide and then we talk to Lily and Cindy? Is that okay with you?
Let me just, I'll say 30 seconds worth of things when you show it, and then.
Okay.
Right. So basically, often, when we teach kids to code, we ask them what problems you want to solve, and then we help them build an app to solve this problem. And that's a really, really important thing to learn. But now we can go on to the questions. There are other sets of questions that are really useful to ask. And that's what I said. I think of this as moral debugging, right? There's the data privacy and security question. There's the is this bias question. There's this question of, is it going to have a disproportionate impact on certain folks who are vulnerable, people who are older, people who have lower incomes? Then we talked about the accuracy question. What if the technology actually isn't accurate? Then we have the efficacy question. Okay, it's accurate, but in fact, it's not going to really help against the virus. And all of these are in a way technical questions, right? We can help students learn how to solve the bias problem. Shall we have data that is much more diverse? Is that going to help train the algorithm better? We can help them think about how do we make this technology more accurate? We can think about how to collect less data and make it more private. But there's a bigger question also that comes when we look at all these different pieces. And what happened in this case was the ACLU came out and said, actually, we don't think that employers should be allowed to use these temperature scanners because we think they're so harmful, they're so inaccurate, they're so ineffective, they are going to have such a disproportionate effect on Black communities and low-income folks that we think we shouldn't do it at all. And so that's like the yes-no question, which I find with my students, like often they've never been asked, is there a technology you wouldn't build? Like we think about nuclear weapons or germ warfare, like is there anything you wouldn't do? And often we're trying to solve the bias question, which I think is really important, before we've even asked, is this okay for humanity? Or maybe, in fact, it's too risky for humanity and we shouldn't build it, right? And then we don't have to worry about the privacy because we're not going to make it. And it's really interesting to me that something so simple as temperature scanners can actually raise all these questions. And it's really relevant for students because many of them, if they're going to go to school, are going to have their temperature scanned. So that's what Diane wanted me to say about the questions.
I just think these are great questions to share with our students. So Lily and Cindy, on the creepy and convenient or threat to humanity, threat to civil liberties scale, where are we right now?
Oh man, that's really tough because I'm all about the fact that a lot of these things are slippery slopes, and I feel that they are so pervasive. It's very much like how Linda Lucas said, yesterday, where does the AI hide? So where does the privacy hide? Where does the data collection hide? We don't know, right? And then if you keep shifting that line, where does the buck stop? When is it okay to mine us? And then is it okay to mine the minors? Or the babies? Is that okay then? If it's okay for a 5-year-old, is it okay then to mine a young infant's information as well? At which point do we decide and do we draw a line in the sand and say, this is no longer ethical. It doesn't benefit society. And we need to just stop.
There's a thing that we talk about at Cornell Tech, and it's more complicated than I can explain right now, but it's called contextual integrity. So we wouldn't have any trouble with us collecting, for instance, Wendy, your child's temperature every day, if you trusted that the person you shared the data with was someone you could trust and that the data was not going to be used for any other purpose than the purpose that it was intended. In that, if we had contextual integrity for the use of our data, this would not be a problem for us. The reason it becomes a problem is because our data gets used in so many different ways, for lots of different reasons, research and privacy and profit and yeah.
Right. And I think it starts off with protection for human life. If we're taking the temperature, that's the intention of having the thermometer, protecting human life. But then it's almost like a cascading effect where there's a lot of potential threat to civil liberties, because knowing that many more minorities are affected by COVID because they're the essential workers, and now they're going to get discriminated, and their access are going to get more limited than it already is. It's unfair.
So we have 1 minute. I just want to say I've put a link to the deck that we use for our whole workshop. Creepy and Convenient is there in the chat. And I'll let Natasha and the team close us out.
Well, my day job is to ask questions. So obviously, I think the most important thing, self-referentially, is to get students to love asking the questions, right? These questions are super interesting. And it's my way of saying to tech companies who say to me, we don't have a valid question, all the questions are valid. And we should just ask more of them. And I think that in itself is a really powerful thing to do. And it gives students agency. And it's not always about hunting for harm. It's just thinking about what's the best possible way we can make this thing to benefit the most amount of people, and how can we mitigate the risks? And and here I would end by asking students, how would you change the temperature technology, right? Is there another system you would use instead, or is there a way you would fix this to make it, reduce all of these risks we have? So thank you so much, and I'll let Lily and Cindy close us.
Thank you so much for having us.
Thank you so much for having us. I think it's really powerful when we can all talk about this in a really real way.
I'm putting my email address in the chat for people who have questions that didn't get answered. We kind of ran out of time and did not quite get to our Q&A. That was our goal. But this is a very, very rich topic. And for our students, I think, super important right now, both in terms of understanding the world around them. There is a link to the survey. Michelle BT put it in a little bit ago. If you go up the chat a little bit, you'll see it. And we'd love your feedback. The link to the deck is there, pinned. Thank you for pinning it, Yana or BT or whoever did that. I hope you guys are having an amazing conference. And we haven't gotten kicked off, so if people want to ask questions in the chat or come up, you can.
I'm going to be sitting at the CSTA virtual booth. If anyone wants to have some more conversations there, come.
And I'm going to go back to work, but I got to put my email address here in the chat, so feel free to contact me with any questions we didn't answer, and thank you so much.
Thank you very much. And this is my moment to encourage you all to join your local chapter of CSTA. And if you live in New York City, join the New York City chapter. We'd love to see you. And we look forward to talking to you more. Thanks, everybody. Thank you. This was great. You guys are amazing. Just jumped. And I want to say thank you to Lily and Cindy. Lily and I were only Twitter friends until very recently. And I'm so glad. All right. Thanks, Natasha. Thanks, everybody.
Bye, guys.
Be safe.